tēnei, tēnei kōrero e pāna ki tēnei kaupapa. I'm just going to start by passing the rākau over to Lance to start us off with karakia.
Kia ora. Mano o mai te Māori nuku, mano o mai te Māori rangi. Ko te Māori kai au, he Māori tupua, ka pakuru mai te pō. Tau mai te Māori, haumi e, hui e, tae ki. Kia ora.
Tēnā koe. So welcome to the short launch recording for the Enhanced Healthcare Home Model of Care. Our panel, who will introduce themselves very shortly, are here to share with you why the need to enhance the healthcare home model of care and also highlights of what has changed. They will share some of the how, but mostly this will be covered by upcoming webinars and peer sessions. So my name is Iri Hapati Mahuika, he uri tēnei no kaitahu, no te taipotini, and I work at Pegasus Health in Canterbury, and I'm going to be facilitating this session today. I'm going to now ask the panel to introduce themselves and ask each member a series of questions. So let's start with you, Whai Bill.
Ai, kia ora mai tata katoa e noho mai nei ki te mātakataki ia māta katoa. Ko Merle Mapuna Samuels hami o rāhau. Ko au, tēnā he consumer for this enhanced model of care with healthcare homes.
Kia ora.
Me.
Kia koe, Lance.
Morena koutou, ko au, ko mango piko te maunga, ko awaro te awa, ko te reo mihi me waiora nā marae, ko Ngāti Kuri te iwi, ko te rarawa, ko Ngāpui, ko Ngāti Whātua aku iwi, ko Lance Norman taku ingoa. I'm Lance Norman, and I'm on this project, I'm the head of equity for the Healthcare Homes Collaboration, but I'm also the head of equity for ProCare Health based in Auckland. Kia ora.
Tēnā koe. Kirsty?
Kia ora, I'm Kirsty Lennon. I'm a GP up in Kapiti, and I have been on the healthcare home journey for 5 years. I am a GP up here, but also I'm the healthcare home clinical lead for Te Ora Campus, and I've been helping the collaborative with the review of the model of care.
Ka pai, and finally to you, Ents.
Kia ora, ko Ants Takawingoa, ko Whanganui te awa, ko Raupohu te maunga, ko Parakino te marae, ko Atianui a Paparangi te iwi. My name is Ants Tamoa. I am practice nurse manager for a practice in Lower Hutt, have been part of the healthcare homes journey since it started. Kia ora.
Tēnā koe, and tēnā koutou. So let's start with our first question, and this one's for you, Whai Merle. How do you think consumers will benefit from this enhanced healthcare home model of care?
I believe that the consumers will benefit from this enhanced model of care through the consumer co-design. What we did was that through whakapanaungatanga, we were able to see how that works, how it's heard, but through the Healthcare Homes Collaborative, or our, excuse me, when we've been feeding in, I have heard the voices of consumer. I've never thought before how that could make the difference. Coming to a point now and realizing through whakawhanaungatanga and having been heard, hearing the voices and the concerns of many who have lived experiences has helped me to know that there are gaps. So healthcare homes and the enhanced model has made access easier, not only for Māori, but the top or high priority groups are out there. So they're able to come in with ease. I believe it's through the voice that has been shared, but we've been able to do a wee bit more than just hearing the voices. Our whole team has been able to work and embed whakawhanaungatanga so that the tentacles of that are actually reaching out and touching others. We know that whakawhanaungatanga is a lived exercise, so we embed it and those concerns about feeling heard, feeling validated, and with the enhanced model, becoming transparent. We know it's a process and model. It's a model that is in working process, my apologies. And I believe that having heard the consumer voices, we've been able, maybe not watertight right now as far as the framework goes, because it is a process that is still in working motion. I believe that we can help that to become more so, but it will be the consumers, the patients, the people using the service that will let us know, and they will see how the equity in there to not only improve what they're receiving and where in the clinic. It is an awesome way to feel, if we were ever going to help make a difference, that the consumer voice has done that, and so has the healthcare homes teams that have worked on this to make sure that those voices are embedded. So kia ora mō tēnā irihāpiti.
Kia ora whaia, tēnā koe. He pātai kia koe, Lance. How, you were on the steering group for this project. Why was it so important for you to be involved?
In health, we have this acronym called DNA, which stands for Did Not Attend. I interpreted DNA as Did Not Attract. So at 2 levels, our Māori whānau are not accessing healthcare services to the same level of non-Māori whānau. So we needed a system that was whānau friendly, and as Whaia Merle has said, it needed to be co-designed and inclusive of whānau voice and whānau lived experience. But it actually needs to connect to the healthcare system. So I want a system that says, how do we attract whānau into the healthcare system rather than how do we put up barriers? I also personally have 4 young children who have Māori descent, and I want them to grow up in the best healthcare condition they possibly can. So if I can influence healthcare change, I would love to do that through this process. Kia ora.
Kia ora. Kirsty, you use this model of care daily as a GP. How do you find it?
I'm really quite excited about this model of care, and I suppose that's where my expertise is, having used it both in New Zealand and elsewhere. And really it needs to be practical, it needs to be usable as a resource, it needs to be sensible. We've already tried the changes at a kaupapa Māori practice to make sure that it's appropriate and usable, and actually that did kind of throw up a few changes that we needed to be made, but on the whole it's worked really well, and we've made the appropriate changes as we move forward. And I think that's the thing to take forward. This is the first version with as equity as a focus, and I would really, that we know that there's more change to come.
Kia ora. And what's the key feature of the model from your perspective?
Yeah, so I think the key feature is just how explicit we've been with these enhancements, down to our wording, our language, prioritising Māori whānau, and I think it does more justice, it honours te tiriti of Waitangi, and I think we've been able to embed that through the whole document, and I think that it just puts that priority on our Māori focus for Māori whānau to get better services, delivery of care and better outcomes. Kia ora.
Kia ora. Back up to you, Whaia Merle. How have you personally felt about contributing to this project?
I never realised that my contribution was the voice of many. When we started, I knew I heard it, but I didn't know how the contribution was going to be embedded. So personally, I felt like I was on a roller coaster to start with, because I'd never been involved in this. But as the roller coaster comes down near the ground, I realised there were heaps of highs, no lows. That's just where it went when it came to rest. So as we've gone along, the nuggets of gold that the lived experience co-design who we have provided have been absolutely wonderful. And it's been the voice of others that have made me feel empowered, but learning about Te Tiriti of Waitangi and knowing that equity is providing for us, Māori, that easier access, that it brings a lot more into the space. I think I have felt personally like everything is out here, but the way the steering group have been, always, they have walked beside me, held my hand, showing me what we're doing. So that kind of role modeling, I know for myself, if it has been role modeled to me, I can understand better how that can roll out for every person that is going to access that service. And the care has been wonderful. So my journey, it's been an awesome journey of learning. Not an easy one, because the language I don't know, but I know the energy and the commitment of the steering group and healthcare homes to come behind this model and make it the best, where it's accessible, where Māori feel like they actually belong, they own it. They can see that their voices have been heard because the team have helped to embed it in a different way, that the feeling of we belong, we were heard. So I'm feeling quite passionate now because my understanding probably comes a wee bit later than everybody else's, but I love it. I absolutely love it. I can't wait for others to be able to feed back so the model keeps progressing as we go through, to know what other things are we not providing, or what are the best things that we are doing, you know, so the voices keep being heard. Kia ora mai.
Kia ora. Lance, from your perspective, why develop this new model of care? What are you hoping to achieve?
These three components of the healthcare homes model of care, and two have been well established. So the first component is a review of the business components within the general practice model. So what we want to achieve there is, if general practices are more financially sustainable, they could actually invest in more staff to look after more of our whānau. So that's an important component from a business point of view. From a clinical point of view, we want all of our clinicians to, so therefore they're looking after our whānau more clinically appropriate. Now, the biggest enhancement we're making to this particular component now is the cultural awareness and cultural aspect on how our whānau would like to be engaged, and how our clinicians could be more culturally aware in situations. And all of those aspects of the healthcare homes model, our people will get better, high quality services, and they'll also get more access and more culturally appropriate services. So in health, we have these huge inequalities, and this model of care will help to reduce those inequalities by helping clinicians and whānau connect in the healthcare system.
Kia ora. Kirsty, a question for you. You were on the team that worked through the enhancements. What were your goals, and do you think that you've achieved them?
Yeah, I think we definitely have achieved them. As I say, there's still room for improvement and change. But we started the exercise with the goal of strengthening the equity focus, looking at consumer involvement, and really honouring Te Tiriti o Waitangi. And I'm really kind of happy with the changes and the enhancements we've made, and it seems to work pretty well.
Ants, in your daily work, you use this model. Can you tell us a little bit about how it benefits your work and your work with your patients?
Yeah, sure. I think it comes down to just how we connect and how we deliver our services. in a way that makes it easier for patients to access, to understand, and to engage. And the better we can do that, the better outcomes we're going to have for our whānau, for our priority patients, and just in better health for New Zealanders. And it's about, being more efficient as clinicians, and having better outcomes so that, we can generate a better future for Aotearoa and for our whānau.
Hi, kia ora. I'm just going to hand it over to Whaimil. Are there any final words of wisdom from you, guidance to those who are implementing this model of care?
Edi Hapati, I came as somebody that felt like I was told I had a reason. I had a purpose in there. For the life of me, I couldn't think what it was, because we have project managers, physicians, nurse practitioners, all that, and I was quite overwhelmed. The pearls of wisdom come with the fact that I've sat at the round table with ngā maungarongo, lofty mountains that have kept sharing, have shown the support. I have no doubt that this enhanced model of care, being a work in progress, I believe that the progress that has been made with the model is one seen to deliver for the people, tātou ngā iwi Māori hoki, and those top priority groups, because we have embedded, as many others may have, embedded the voice and tried to remain transparent through it. Work with seeing how whakawhanaungatanga can start to draw them back in, trying to keep in mind the equity within all those other domains that you work through in the clinic, but making it a patient experience. I think the wisdom in there is knowing at the start, everybody set out because it was to make a difference. If the start and coming to this point is about a cultural shift, because moku he Māori, mo tātou ngā iwi Māori, when we feel like we are being heard and we hear our reo, we not only feel at home, everybody, and I've heard many times, if something can work for Māori, it will work for the many. And I truly believe that the work done by Healthcare Homes, the steering committee, and every other person, e ngā mana e ngā reo, e ngā kāranga maha, I whakarungo au ki te kāranga o koutou katoa mō tēnei ta mahi hei whakapakari. And tino honore he karoria kia koutou katoa, he maunga rongo. Working with you all, I feel more humbled that I could bring the consumer voice to the table. I have not felt like it is enough when I hear how the framework goes without what you have all done and included me, the holder of the baton, and the baton being the voice of consumer. We truly thank, with a gratitude, Healthcare Homes for the inclusion, for the involvement. Kia koutou katoa, tēnā koutou, kia ora mai tātou katoa, ko koe hoki iri hapati, Amajid ko koe hoki, kia mātou tīma, kia ora.
Nā koe whae, kei te mihi ki a koe. We'll just pass over to the rest of our panel for to finish off our kōrero. So Lance, where to from here?
Oh, kia ora, Eddie, and I'm not crying, you're crying. So you imagine, so in my whakapapa, I am New Zealand Māori, I am New Zealand European, I have teenagers, I'm from an iwi that's the furthest in the far north. It's 4 hours from a hospital. It has maternity care. Our healthcare system is designed for my New Zealand European part of me. It's not always designed for my Māoriness. It's not designed for my ruralness, and it's not designed for even my urban Māori status. So this is a great journey, and it's not the end of our journey. It's a great journey to rectify all of me and look after all of me as a person, as a whānau, and as a Māori community. But could you imagine in the future, I get a text in Te Reo Māori 5 minutes before my general practice appointment saying, your appointment will be ready in 5 minutes, Lance, so you don't have to wait in the waiting room for 45 minutes. I walk into the reception and all my iwi data is in the practice management system. And the whānau behind the reception desk says, kia ora, Lance, how's your Ngāti Kuri treaty settlement going? Take a seat, the doctor will be with you in 5 minutes. The nurse either looks like me or can talk like me when they're doing their needs assessment. The doctor, before they touch my head or take blood from me, has an awareness that culturally I would like to do karakia before that. And may even learn karakia with me and do karakia before they do my intervention. So this is a great journey into the cultural awareness, improvement of general practice model, but it's just the start of our journey. So where we can end up has significant positive impact for all New Zealanders in this model of care. Kia ora.
Tēnā koe. Kirsty, I'm going to pass over to you to give some messages possibly to your fellow GPs around the country about this model of care, and yeah, just any closing remarks from you as well from your space.
I think that we need to change. I think that you know, we've made a lot of changes here. There's going to be a big focus on equity and priority populations, the emphasis on honouring the treaty, and really aligning this model of care with the Paiora Healthy Futures model and vision, with some really good core values, which we need to take forward and feel involved in our everyday care of patients. And I think hopefully the model is actually, you can hear the voices that we've had plenty of mahi with. I hope that voice is coming through. And we are hoping to help you in this process as well. We are developing resources around it so that, you know, we can take this forward. I think very much we need some resource of the why, and then we need some very good resource of the how. And that's where our next bit of work is focusing. So we're here to help, but this is such a priority. There is no quality without equity. I think that's my key message here. And for my fellow GPs, we're here to help. This model should take us forward. It's not perfect. There will be steps after this, but for now, I think we've done quite a good job in taking it forward. Yeah.
Ngā mihi, Kirsty. And just to pass over to you, Ants, for the final question, if it's okay. Being a part of the development of this model, can you tell us how it's going to be rolled out, what supports are on offer? I know Kirsty's mentioned a little bit, but just to help practices put this into practice.
Yeah, sure. So look, watch this space. We are going to be bringing webinars. We're going to be bringing, you know, podcasts, lots of information, lots of support to implement this healthcare homes model into your practice. We're developing a range of resources to help support the shift, so ensuring a more equitable approach within your GP area. So our mahi isn't over yet, but we've made great progress, and I'm just looking really forward to seeing all the positive changes in general practice that this model has got to offer. I know I feel from a nursing perspective that we've always been guided on the principles of te tiriti o Waitangi, and I think that there's always improvements, and I think that we can always get stuck in ways of what we used to do or how we think things should be. And I think it's about, you know, opening our minds now, looking at the statistics in Aotearoa, seeing that we need to do some more work for our Māori whānau and our priority patients. And it's about how we're going to do that. Let's look at this, let's be positive, let's get behind this, let's put our differences aside, let's just open our hearts to kindness really on every level for our whānau going forward.
Ora, I runga I tērā kōrero, I runga I te aroha me te manaakitanga kei te mihi ki a tātou kua tai mai nei, ki te kōrero I roto I tēnei kaupapa. So I'm just going to ask Whaimil to finish us off with karakia, if that's okay.
Tēnā koe di hapiti mō tō mahi hoki he kaiarahi mō mātou ki te hui. Tēnā koe, ngā mihi hoki, ana e tētahi, he karakia whakamutinga mō mātou, he inoi tātou. Kia tātou katoa, te atawhai o tō tātou riki a ehu karaiti, me te aroha o te atua, me te whiwhinga tahitanga ki te wairua tapu, hei a whina, hei tohu tohu, ia mātou katoa, ake tonu ake, āmene. And just before you all go, I'd like to leave you with this as well, you know it, and you all work with it every day. He aha te menui o te ao. He tangata, he tangata, he tangata. It is you, it is me, it is all that we are involved with. Kia ora mai tātou katoa mo tēnei hui. Thank you, everybody.
Kia ora.
Kia ora.
Kia ora.
Ka whānau.